Hi dear friends, welcome to Medical Destiny YouTube channel. Before watching this video, please take a moment to subscribe my channel. In this video, you will go through 25 Nclex-Rn nursing examination multiple choice questions and answers. Read the question by yourself and find the correct answer. Let's begin.
281. The nurse is applying ECG electrodes to a diaphoretic client. The nurse does which of the following to keep the electrodes from coming loose? 1. Secures the electrodes with adhesive tape. 2. Places clear, transparent dressings over the electrodes. 3. Applies lanolin to the skin before applying the electrodes. 4. Cleanses the skin with alcohol before applying the electrodes. Answer: 4. Rationale: alcohol defats the skin and helps the electrodes adhere to the skin. Placing adhesive tape or a clear dressing over the electrodes will not help the adhesive gel of the actual electrode to make better contact with the diaphoretic skin. Lanolin or any other lotion makes the skin slippery and prevents good initial adherence. 282. The nurse has developed a plan of care for a client with a diagnosis of anterior cord syndrome. Which intervention should the nurse include in the plan of care? 1. Change the client's positions slowly. 2. Assess the client for decreased sensation to touch. 3. Assess the client for decreased sensation to vibration. 4. Teach the client about loss of motor function and decreased pain sensation. Answer: 4. Rationale: anterior cord syndrome is caused by damage to the anterior portion of the gray and white matter. Clinical findings related to anterior cord syndrome include loss of motor function, temperature sensation, and pain sensation below the level of injury. The syndrome does not affect sensations of touch, position, and vibration. 283. The nurse is caring for a client with a thoracic spinal cord injury. As part of the nursing care plan, the nurse monitors for spinal shock. In the event that spinal shock occurs, the nurse anticipates that the most likely intravenous fluid to be prescribed would be 1. Dextran, 2. 0.9% normal saline, 3. 5% dextrose in water, 4. 5% dextrose in 0.9% normal saline. Answer: 2. Rationale: normal saline 0.9% is an isotonic solution that primarily remains in the intravascular space, increasing intravascular volume. This fluid would increase the client's blood pressure. Dextran is rarely used in spinal shock because isotonic fluid administration is usually sufficient. Additionally, Dextran has potential adverse effects. Dextrose 5% in water is a hypotonic solution that pulls fluid out of the intravascular space and is not indicated for shock. Dextrose 5% in normal saline 0.9% is hypertonic and may be indicated for shock resulting from hemorrhage or burns. 284. The nurse prepares to teach a client to ambulate with a cane. Before teaching cane-assisted ambulation, the priority nursing assessment is to determine that the client has 1. A high level of stamina and energy, 2. Self-consciousness about using a cane, 3. Full range of motion in lower extremities, 4. Balance, muscle strength, and confidence. Answer: 4. Rationale: assessing the client's balance, strength, and confidence helps determine if the cane is a suitable assistive device for the client. A high level of stamina and full range of motion are not needed for walking with a cane. Although body image, self-consciousness, is a component of the assessment, it is not the priority. 285. A physician prescribes 1000 ml of normal saline to infuse at 100 ml/hour. The drop factor is 10 drops per milliliter. The nurse sets the flow rate at how many drops per minute? Round your answer to the nearest whole number, _drops per minute. Answer: 17. Rationale: it will take 10 hours for 1000 ml to infuse at 100 ml/hour, 1000 ml divided by 100 ml 1/4 10 hour. Next, Use the intravenous 4 flow rate formula. 286. A nurse is assessing a client with cardiac disease at the 30-week gestation antenatal visit. The nurse assesses lung sounds in the lower lobes after a routine blood pressure screening. The nurse performs this assessment to 1. Identify mitral valve prolapse. 2. Identify cardiac dysrhythmias. 3. Rule out the possibility of pneumonia. 4. Assess for early signs of congestive heart failure, CHF. Answer: 4. Rationale: fluid volume during pregnancy peaks between 18 and 32 weeks gestation. During this period, it is essential to observe and record maternal data that would indicate further signs of cardiac decompensation or CHF in the pregnant client with cardiac disease. By assessing lung sounds, the nurse may identify early symptoms of diminished oxygen exchange and potential CHF. Options 1, 2, and 3 are not related to the data in the question. 287. The nurse is caring for a client receiving digoxin, lanoxin. Which of the following manifestations correlate with a digoxin level of 2.3 nanograms/dl? Select all that apply. 1. Nausea. 2. Drowsiness. 3. Photophobia. 4. Increased appetite. 5. Increased energy level. 6. Seeing halos around bright objects. Answer: 1, 2, 3, 6. Rationale: digoxin is a cardiac glycoside used to manage and treat heart failure, control ventricular rate in clients with atrial fibrillation, and treat and prevent recurrent paroxysmal atrial tachycardia. The therapeutic range is 0.5 to 2.0 nanograms/dl. Signs of toxicity include gastrointestinal disturbances, including anorexia, nausea, and vomiting, neurological abnormalities such as fatigue, headache, depression, weakness, drowsiness, confusion, and nightmares, facial pain, personality changes, and ocular disturbances such as photophobia, halos around bright lights, and yellow or green color perception. 288. The emergency department nurse prepares for which interventions in the care of a child with epiglottitis? Select all that apply. 1. Obtaining a chest X-ray. 2. Obtaining a throat culture. 3. Monitoring pulse oximetry. 4. Maintaining a patent airway. 5. Providing humidified oxygen. 6. Administering antipyretics and antibiotics. Answer: 1, 3, 4, 5, 6. Rationale: epiglottitis is an acute inflammation and swelling of the epiglottis and surrounding tissue. It is a life-threatening, rapidly progressive condition that may cause complete airway obstruction within a few hours of onset. The most reliable diagnostic sign is an edematous, cherry red epiglottis. The primary concern is the development of complete airway obstruction. Therefore, the child's throat is not examined or cultured because any stimulation with a tongue depressor or culture swab could trigger complete airway obstruction. Some interventions include maintaining a patent airway, providing humidified oxygen, monitoring pulse oximetry, obtaining a chest X-ray film, and administering antipyretics and antibiotics. The child may also require intubation and mechanical ventilation. 289. A child with rheumatic fever is admitted to the hospital. The nurse reviews the child's record and expects to note which clinical manifestations documented in the record. Select all that apply. 1. Cardiac murmur. 2. Cardiac enlargement. 3. Cool pale skin over the joints. 4. White painful skin lesions on the trunk. 5. Small non-tender lumps on bony prominences. 6. Purposeless jerky movements of the extremities and face. Answer: 1, 2, 5, 6. Rationale: rheumatic fever is a systemic inflammatory disease that may develop as a delayed reaction to an inadequately treated infection of the upper respiratory tract by group A beta hemolytic streptococci. Clinical manifestations of rheumatic fever are related to the inflammatory response. Major manifestations include arthritis manifested as tender, warm erythematous joints, carditis manifested as inflammation of the endocardium, including the valves, myocardium, and pericardium, cardiac murmur and cardiac enlargement, chorea, manifested as involuntary, purposeless jerky movements of the legs, arms, and face with speech impairment, erythema marginatum, manifested as red, painless skin lesions usually over the trunk, and subcutaneous nodules, manifested as small non-tender lumps on joints and bony prominences. 290. A client is hospitalized with a diagnosis of thrombophlebitis and is being treated with HAAD infusion therapy. About 24 hours after the infusion has begun, the nurse notes that the client's partial thromboplastin time, PTT, is 65 seconds with a control of 30 seconds. What is the appropriate nursing action? 1. Discontinue the HAAD infusion. 2. Prepare to administer protamine sulfate. 3. Notify the physician of the laboratory results. 4. Do nothing because the client is adequately anticoagulated. Answer. 4. Rationale. The effectiveness of HAAD therapy is monitored by the results of the partial thromboplastin time, PTT. Desired range for therapeutic anticoagulation is 1.5 to 2.5 times the control. A PTT of 65 seconds is within the therapeutic range. Therefore options 1, 2, and 3 are incorrect actions. 291. A man is brought to the emergency department complaining of chest pain. His vital signs are blood pressure, BP 150 90ths mm Hg, pulse, p, 88 beats per minute, BPM, and respirations, r, 20 breaths per minute. The nurse administers nitroglycerin 0.4 mg sublingually. To evaluate the effectiveness of this medication, the nurse assesses for the relief of chest pain and expects to note which of the following changes in the vital signs. 1. BP 150 90ths mm Hg, P70 BPM, R 24 breaths per minute. 2. BP 160ths mm Hg, P96 BPM, R 20 breaths per minute. 3. BP 160ths mm Hg, P70 BPM, R 24 breaths per minute. 4. BP 160/100 mm of mercury, P 120 BPM, R 16 breaths per minute. Answer. 2. Rationale. Nitroglycerin dilates both arteries and veins, causing blood to pool in the periphery. This causes a reduced preload and therefore a drop in cardiac output. This vasodilation causes the blood pressure to fall. The drop in cardiac output causes the sympathetic nervous system to respond and attempt to maintain cardiac output by increasing the pulse. Beta blockers, such as propranolol, Inderal, are often used in conjunction with nitroglycerin to prevent this rise in heart rate. If chest pain is reduced and cardiac workload is reduced, the client will be more comfortable, therefore a rise in respirations should not be seen. 292. A client who has had an abdominal aortic aneurysm repair is 1 day postoperative. The nurse performs an abdominal assessment and notes the absence of bowel sounds. The nurse should, 1. Feed the client. 2. Call the physician immediately. 3. Remove the nasogastric, NG, tube. 4. Document the finding and continue to assess for bowel sounds. Answer. 4. Rationale. Bowel sounds may be absent for 3 to 4 days postoperative because of bowel manipulation during surgery. The nurse should document the finding and continue to monitor the client. The NG tube should stay in place if present, and the client is kept NPO until after the onset of bowel sounds. Additionally, the nurse does not remove the tube without a prescription to do so. There is no need to call the physician immediately at this time. 293. A nurse is caring for a client with gestational hypertension who is in labor. The nurse monitors the client closely for which complication of gestational hypertension? 1 seizures, 2 hallucinations, 3 placenta previa, 4 altered respiratory status. Answer: 1. Rationale: gestational hypertension can lead to preeclampsia and eclampsia. Therefore, a major complication of gestational hypertension is seizures. Hallucinations, placenta previa, and altered respiratory status are not directly associated with gestational hypertension. 294. The nurse provides which medication instructions to a client who has been prescribed levothyroxine, Synthroid? Select all that apply. 1. Monitor your own pulse rate. 2. Take the medication in the morning. 3. Notify the physician if chest pain occurs. 4. Take the medication at the same time each day. 5. Expect the pulse rate to be greater than 100 beats per minute. 6. It may take 1 to 3 weeks for a full therapeutic effect to occur. Answer: 1, 2, 3, 4, 6. Rationale: levothyroxine is a thyroid hormone. The client is instructed to take the medication at the same time each day to maintain hormone levels. The client is also instructed to take the medication in the morning before breakfast to prevent insomnia. The client is told not to discontinue the medication and that thyroid replacement is lifelong. Additional instructions include monitoring own pulse rate and contacting the physician if the rate is greater than 100 beats/minute, and notifying the physician if chest pain occurs, or if weight loss, nervousness and tremors, or insomnia develops. The client is also told that full therapeutic effect may take 1 to 3 weeks and that he or she needs to have follow-up thyroid blood studies to monitor therapy. 295. During an initial prenatal visit, a hemoglobin level is obtained on a client in her first trimester of pregnancy. The nurse reviews the results and determines the findings to be abnormal and indicative of iron deficiency anemia. The nurse performs an assessment on the client expecting to note which of the following in this type of anemia. 1. Pink mucous membranes. 2. Increased vaginal secretions. 3. Complaints of headaches and fatigue. 4. Complaints of increased frequency of voiding. Answer: 3. Rationale: iron deficiency anemia is described as a hemoglobin blood concentration of less than 10.5 to 11.0 grams/dl. Complaints of headaches and fatigue are abnormal findings and may reflect complications of this type of anemia caused by the decreased oxygen supply to vital organs. Options 1, 2, and 4 are normal findings in the first trimester of pregnancy. 296. The nurse is caring for a client with multiple myeloma who is receiving intravenous hydration at 100 ml per hour. Which finding indicates a positive response to the treatment plan? 1. Creatinine of 1.0 mg/dl. 2. Weight increase of 1 kg. 3. White blood cell count of 6000/3. 4. Respirations of 18 breaths per minute. Answer: 1. Rationale: multiple myeloma is a malignant proliferation of plasma cells within the bone. Renal failure is a concern in the client with multiple myeloma. In multiple myeloma, hydration is essential to prevent renal damage resulting from precipitation of protein in the renal tubules and excessive calcium and uric acid in the blood. Creatinine is the most accurate measure of renal status. Options 3 and 4 are unrelated to the subject of hydration. Weight gain is not a positive sign when concerned with renal status. 297. A nurse provides discharge instructions to a client with testicular cancer who had testicular surgery. The nurse tells the client, 1. To avoid driving a car for at least 8 weeks. 2. Not to be fitted for a prosthesis for at least 6 months. 3. To avoid sitting for long periods for at least 6 months. 4. To report any elevation in temperature to the physician. Answer: 4. Rationale: for the client who has had testicular surgery, the nurse should emphasize the importance of notifying the physician if chills, fever, drainage, redness, or discharge occurs. These symptoms may indicate the presence of an infection. 1 week after testicular surgery, the client may drive. Often, a prosthesis is inserted during surgery. Sitting needs to be avoided with prostate surgery because of the risk of hemorrhage, but this risk is not as high with testicular surgery. 298. A multidisciplinary team is working with the spouse of a home care client who has end-stage liver failure and is teaching the spouse about pain management. Which statement by the spouse indicates the need for further teaching? 1. My husband can use breathing exercises to control pain. 2. I will help to prevent constipation with increased fluids. 3. If the pain increases, I will report it to the nurse promptly. 4. The medication causes very deep sleep that my husband needs. Answer: 4. Rationale: in the client with liver disease, the ability to metabolize medication is affected. A decreased level of consciousness is a potential clinical indicator of medication overdose, as well as fluid, electrolyte, and oxygenation deficiencies. Thus the nurse teaches the client's spouse about the differences between sleep related to pain relief and a deteriorating change in neurological status. Options 1, 2, and 3 all indicate an understanding of suitable steps to be taken in pain management. 299. A nurse is reviewing the antenatal history of a client in early labor. The nurse recognizes which of the following factors documented in the history as having the greatest potential for causing neonatal sepsis after delivery. 1. Adequate prenatal care. 2. History of substance abuse during pregnancy. 3. Appropriate maternal nutrition and weight gain. 4. Spontaneous rupture of membranes 2 hours ago. Answer: 2. Rationale: risk factors for neonatal sepsis can arise from maternal, intrapartal, or neonatal conditions. Maternal risk factors before delivery include low socioeconomic status, poor prenatal care and nutrition, and a history of substance abuse during pregnancy. Premature rupture of the membranes or prolonged rupture of membranes greater than 18 hours before birth is also a risk factor for neonatal acquisition of infection. 300. A nurse performs a prenatal assessment on a client in the first trimester of pregnancy and discovers that the client frequently consumes beverages containing alcohol. The nurse initiates interventions to assist the client to avoid alcohol consumption so as to primarily, 1. Reduce the potential for fetal growth restriction in utero. 2. Promote the normal psychosocial adaptation of the mother to pregnancy. 3. Minimize the potential for placental abruptions during the intrapartum period. 4. Reduce the risk of teratogenic effects to developing fetal organs, tissues, and structures. Answer: 4. Rationale: the first trimester, organogenesis, is characterized by the differentiation and development of fetal organs, systems, and structures. The effects of alcohol on the developing fetus during this critical period depend not only on the amount of alcohol consumed, but also on the interaction of quantity, frequency, type of alcohol, and other drugs that may be abused during this period by the pregnant woman. Eliminating consumption of alcohol during this time may promote normal fetal organ development. Although options 1, 2, and 3 may be concerns, they are not specifically associated with the first trimester of pregnancy. 301. The nurse is admitting a client with a diagnosis of hypothyroidism to the hospital. The nurse performs which of the following that will provide data related to this diagnosis? 1. Inspects facial features. 2. Auscultates lung sounds. 3. Percusses the thyroid gland. 4. Assesses the client's ability to ambulate. Answer: 1. Rationale: inspection of facial features will reveal the characteristic coarse features, presence of edema around the eyes and face, and the blank expression that are characteristic of hypothyroidism. The assessment techniques in options 2, 3, and 4 will not reveal information related to the diagnosis of hypothyroidism. 302. The nurse is teaching a client with chronic obstructive pulmonary disease, COPD, how to do pursed lip breathing. Evaluation of understanding is evident if the client demonstrates which of the following? 1 breathes in and then holds the breath for 30 seconds. 2 loosens the abdominal muscles while breathing out. 3 inhales with pursed lips and exhales with the mouth open wide. 4 breathes so that expiration is 2 to 3 times as long as inspiration. Answer: 4. Rationale. Chronic obstructive pulmonary disease is a disease state characterized by airflow obstruction. Prolonging expiration time reduces air trapping caused by airway narrowing that occurs in COPD. Tightening, not loosening, the abdominal muscles aids in expelling air. Exhaling through pursed lips, not with the mouth wide open, increases the intraluminal pressure and prevents the airways from collapsing. The client is not instructed to breathe in and hold the breath for 30 seconds. This action has no useful purpose for the client with COPD. 304. A client is taking lithium carbonate, lithobid, for the treatment of bipolar disorder. Which assessment question should the nurse ask the client to determine signs of early lithium toxicity? 1. Do you have frequent headaches? 2. Have you noted excessive urination? 3. Have you been experiencing leg aches over the past few days? 4. Have you been experiencing any nausea, vomiting, or diarrhea? Answer: 4. Rationale. One of the most common early signs of lithium toxicity is gastrointestinal (GI) disturbances such as nausea, vomiting, or diarrhea. The assessment questions in options 1, 2, and 3 are unrelated to the findings in lithium toxicity. 305. A postpartum nurse is caring for a client who delivered a viable newborn infant 2 hours ago. The nurse palpates the fundus and notes the character of the lochia. Which characteristic of the lochia would the nurse expect to note at this time? 1. Pink-colored lochia. 2. White-colored lochia. 3. Serosanguineous lochia. 4. Dark red-colored lochia. Answer: 4. Rationale. When checking the perineum, the lochia is monitored for amount, color, and the presence of clots. The color of the lochia during the 4th stage of labor, the first 1 to 4 hours after birth, is a dark red color. Options 1, 2, and 3 are not the expected characteristics of lochia at this time period.